is Cara Mitrano. I am co-president of JIGSAW, the undergraduate LGBT group on campus. And also this year, I was selected as a winner for the Advocates for Youth Great American Condom Campaign. So all of the condoms that are available as prizes for the raffle were provided through Advocates for Youth, and Wayne State is officially a safe site for 2018. So I'm very proud to represent that. My topic is about LGBTQ+ sex education and safer sex resources. So first, for those of you that have phones or laptops, I'd like to get input from you about what you know about this topic. So to do this, I'll pull up the page on the screen, but go to this website in your browser, like now. Pull out your phone, go there. So pollev.com/CaraMitrano409. And then enter your thoughts. So what do you think of when I say sex education or safer sex resources? Shorter words or phrases will work better. And then also very important, just the software we're using. If you're using multiple words, hyphenate them so they show up together on the screen, and separate things that should be separate with commas. And it is anonymous, as it says, so if you're, don't worry, it won't be tied to your name at all. And once you send things, there we go. So send in your thoughts. All right, so feel free to keep doing that. But I do see a lot of things that are repeated. So things like abstinence only, shame options, queer inclusivity, I'm gonna talk about that, of course. Not enough resources, it's very common. Shame, unfortunate, but something we're gonna address as well, particularly in the context of LGBTQ youth. And needs more attention, need culturally appropriate resources. You all have a lot of good ideas. Thank you for sharing. Give it a minute so everyone's responses get up there. All right. All right, so it seems like you all have a lot of ideas, and some of the stuff there are things I'm going to talk about. It's unfortunate that shame is such a large one. Well, it's unfortunate in the real world. All right. So thank you all for participating, especially I know that's kind of a weird format, but hopefully it was useful to kind of get a sense of what everyone else is thinking. So to give you an overview of the way I'll be structuring this is first I want to talk about sex education in America, a little bit of the history, why the American public and the government thought that it was necessary to teach in public schools, the current debates today and state laws that apply to what can and cannot be taught in sex education classes, and then the students, or the services that students report receiving, because what the law says and what students actually hear or receive may be very different. And then also I'd like to address the topic of safer sex resources. So what is available, the accessibility for LGBTQ+ individuals, and how the LGBT individuals may use these materials in a different way as compared to the norm or the average, or the way that they are marketed or advertised. So that's something to be aware of, whether you're working with these materials yourself, if you're distributing them, or if you are a healthcare practitioner advising your patients on how to use these materials. Realize that they may be used in varying ways. So first, as I said, sexual education. The history of sex ed is actually not that long, really, when you think about it. And it began with concerns about the rising teen pregnancy rates and then, of course, HIV and AIDS. So parents and the government and just the general public decided that students needed some kind of formal education to reduce the risk. In the late 1890s, or 1980s to early 1990s, the implementation of sex education in public schools began. However, there were divergent beliefs, and that we still see today, whether we should focus on abstinence only or abstinence only until marriage, or comprehensive sex education, which would be how to practice sex and do it safely. What are the things you would need to know to give informed consent to doing certain activities? What are the consequences and possible benefits? And then in the late 1990s, abstinence only until marriage, or AOUM, became the national approach. If you go on the government websites now, federal guidelines, it includes information on abstinence, and abstinence is stressed, particularly in our current administration. Some of the other information has been taken down. This was part of a welfare reform agenda, and it emphasized heterosexual marriage as the only appropriate sexual activity, and of course limited the definition of marriage to heterosexual couples only. So you can already begin to see how this may not really suit the needs of LGBT students, especially youth. They're still developing, they're still learning about themselves and the people around them, how to have relationships, and these messages really don't apply to them. So currently, there is still debate about abstinence only versus comprehensive sexual education. So in the fiscal year of 2018, the funding for abstinence only education increased by 10 million to a total of 85 million from the federal government. And that's to support abstinence only programming in public schools. And as I'm sure many of you know, research indicates that comprehensive sex ed delays initiation of sexual activity and reduces teenage pregnancies and STI transmission, where abstinence only does not have such results. In fact, in many of the states where abstinence only sex ed is required or preferred or practiced more often, those states actually have some of the highest rates of teen pregnancy. So research really doesn't support that abstinence only is the best method for teaching students. And then I think it's important to note, especially in the context of LGBT youth, that comprehensive sex ed is inclusive sex ed, right? So as I mentioned, abstinence-only education stigmatizes homosexuality and doesn't address almost any LGBT issues except for HIV and AIDS. That was included since that was part of the original purpose of introducing this into the public schools. And making it inclusive means that the information applies to everyone, including LGBT students. And that inclusivity can be what kinds of sexual activities count as sex? What ways can STIs be transmitted? What does a healthy relationship look like using different genders? Gender identity, making sure that transgender youth that may attend these classes are able to learn about themselves and see themselves represented in course materials. Otherwise, there's the very real danger that they may not understand how this information relates to them, and they may receive the wrong information and be uneducated about what risks are present for them. So as I said, includes discussion in sexuality, gender, and medically accurate information in a non-stigmatizing way. That medically accurate is very important, which that's something that I didn't realize a while ago, because I thought that if you're teaching medical information, of course you would want it to be accurate, right? Well, first, there are many states that don't require sex education. So a total of 28 do not have a state law that requires that sex education be taught in public schools. Some of them still do, even though it's not required. But we'll get to that a bit later. And then this is what I was saying about medically accurate, that there are many states, a total of 37, including DC, that do not require that their sex education and HIV education be medically accurate. I'm sure you can all understand the dangers of this if someone is given the wrong information or given, like you said in the word bubble, just shame information that, for example, homosexual sexual activity is always wrong, you will get HIV, and that's it. Obviously not correct, but if your state doesn't require that your information is medically accurate, a teacher in a public school would be able to say that, especially to young students who may not know to look elsewhere to get information from other sources. They may believe it and just think that's, it. And then this one was really sad for me. There are 3 states in our union that require that only negative information is shared about same-sex relationships. And in Utah as well, the state law prohibits teachers from responding to students' spontaneous questions in a way that conflicts with the state laws. So for example, if a student in a sex ed class in Utah asks the professor, I'm male and I want to have sex with my boyfriend, but I want to do it in a safe way. Can you tell me about that? The teacher would not be able to answer that in the medically accurate, comprehensive way that affirms the relationship. So, I'm sure that doesn't need a lot of explaining why that's bad for LGBT youth, right? If you see yourself constantly stigmatized or you're not allowed to be represented positively in your own classes, in your own school. However, even though the states have these varying policies, the CDC data from 2016 recognizes that sexual minority students, or LGBT students, have a higher prevalence of many health risk behaviors, and that includes sexual health risk behaviors and other like drug use, alcohol use, more likely to report being or having been pregnant than their non-LGBT peers. And the CDC also acknowledges that safe, supportive school environments are linked to better educational and health outcomes. So they have this federal report that goes out every year, and that's where this data is from. So they looked at schools across states and then in large urban school districts, and they monitored which ones had supplemental instruction on LGBTQ+ topics, so that would be in the sex ed or the health class. Did they talk about same-sex relationships? Did they talk about, other types of sexual activity beyond like heterosexual intercourse, that kind of thing? And then concurrent, so with the supplemental instruction, did they also have adherence to specific recommendations that related to having a safe, supportive environment? So that would be things like having a safe space, having trained faculty that students could talk to if they need to, things like that, and the full list is in the CDC document. So as you can see, the percentages are rather low, except for in large urban school districts, they have some form of supplemental instruction in most of cases. But you can also see the error bars on those. I entered the top and bottom values, and there is a huge range across. So it's not consistent. You can't say, well, my school in Michigan has this kind of policy and I got good sex ed, so Michigan's probably okay, for example. That's really not the case. It depends entirely on each individual school. Like this range was this where it says a median of 12.2, it was a range of 2.6 to 40% of schools that adhered to the guidelines. So that's a huge range, and it's whether you're a student in each particular school will affect the education you receive drastically. And then lastly, on the topic of sexual education, it's important to listen to the student experiences. Like I said, just because the state law permits or excludes something doesn't necessarily mean that the school adheres to those guidelines or that the students have the same perception. So according to the Glisson National School Climate Survey from 2013, which is the year that they asked this specific question, but they do put one out every year, less than 5% of students surveyed reported positive representation of LGBTQ+ topics in their health classes. And then from a survey of millennials to determine their attitudes on sexual behaviors, religion, and reproductive health, only 12% of them reported any discussion of same-sex relationships in their sex ed classes. So you can see, also, many schools choose not to provide inclusive sex education even when the law permits it. So like I was saying, there's this huge variance across schools. It depends on where you go. And you can see how for LGBT youth who are still learning about themselves, how to work with other people in relationships, not having this information can be incredibly detrimental, especially when you're comparing to non-LGBT peers who do get the information that they need. Sometimes, that's not always. So then the second part is about safer sex resources. And I'm also going to but I'm going to ask you to participate as well in this. So how many of you recognize what this is? Just raise your hand. All right, everyone. I'm not surprised. What about that? Okay, most, but less. And what about those? A few less. So most of you did know, but you are also at this seminar, so it's a little bit of a biased sample. So those on your left are often called male or penile condoms. And then this is a female or vaginal condom. I say female because that's the branded name. And then these are dental dams. So these are used for various types of sexual activity beyond heterosexual intercourse. And as part of inclusive, comprehensive sexual education, these are things that all students would need to know about in order to have safer sex, if they are choosing to do so. So a lot of times, even though these resources exist, they are less accessible for LGBTQ individuals as compared to non-LGBT individuals. So for example, the instructions on the standard condoms, the first one that you saw, typically focus on the proper use, which is good, but only for heterosexual intercourse. Even the condoms I received from Advocates for Youth, they include instructions, but they're not, inclusive, comprehensive instructions. They don't cover other uses of condoms or how you can make them into a dental dam. So you can see how they're marketed really to only one type of person or one type of sexual relation. And then also since 1993, the vaginal condoms have been subject to stricter regulations because they're regulated as a Class 3 medical device instead of Class 2 like other forms of condoms. So this means there's less competition in the market because it takes a lot more to, develop this, do all the testing, get it to market. Only about 10% of medical devices fall into this category. So it's pretty strictly regulated, which it really doesn't need to be, and there's several lobbying groups that are fighting to make it less strictly regulated because there isn't a reason to have it in that class. And there actually was an update, I think, from the CDC or the FDA. They're reconsidering classification from Class 3 to Class 2, so that would be a down regulation, as of December 2017. So we'll see how that turns out. And then also, as you saw from this group, and then in general, dental dams are less well known and less available than condoms. So they're available in less stores and people are less educated about them. And then additionally, many people do believe that you cannot transmit STIs through oral sex. So in one study from the UK that examined people 16 and above, over half of them did not know that. So you can see how this all ties back into the education. So if an LGBT student doesn't know that you can get STIs through oral sex, and they don't know what a dental dam is, they don't know how to protect themselves, when they don't even know that they need to, you can see how this can lead to negative health outcomes for that student that other students may or may not experience. And then, like I mentioned, there's variant usage for LGBT individuals. So condoms or other barrier methods, like I showed, are not necessarily synonymous with contraceptives, right? You can be using it for prevention of STI transmission instead of prevention of pregnancy, right? Because some couples cannot get pregnant that way. And then, like I mentioned, condoms can be used for sexual activities beyond heterosexual intercourse, so they make, anything that involves hand to genital or mouth to genital contact safer, again, reduction of STI transmission, or less likely. And that sexually active LGBT people still need STI protection, right? So they need to know what is available, be able to access it, have the instructions applied to them, understand, how it relates to their anatomy, if their gender is different from their sex, that kind of thing. And then also, if able to get pregnant, may consider them to be contraceptives or birth control, right? So depending on biology and what the pair is, knowing what the risks are for them, what methods apply to them, and what would be useful, and how to use it. Those are all very important, and we need to consider those not only at the public education level, but also for the companies that are providing these products and how they market those and provide their instructions. So, in summary, based on this, the research I've done on this, the ways to, or some suggestions on ways to reduce LGBTQ plus sexual health disparities are to provide comprehensive, medically accurate sexual education in public schools and wherever else available, and also positive representation of LGBTQ plus topics, so that way people, well, LGBT youth do not feel stigmatized, feel accepted in their community. It's linked to better sexual and general health and educational outcomes. And then to adopt and enforce state and national standards along those lines. There's actually a document out that has these standards, but the states and obviously the federal government are not adopting it, even though it's all written out about the guidelines. It's a really good document, you should read it. And then also for us as individuals, if you're a healthcare provider, if you know people who are, or you're a future healthcare provider, right, to understand and promote safer sex resources in an informative, inclusive way. So, like I mentioned, condoms are not only for heterosexual couples. Use inclusive language whenever possible, right? So, for example, a transgender woman may not like referring to that condom as a male condom if she's going to use it. But you need to figure out a way to describe this in a way that she's going to protect herself in whatever kind of sexual activity that she is pursuing or having. And then also providing alternative to standard condoms like vaginal condoms and dental dams, so that all of these resources are available, people have the most options possible, and they're educated about how to use those things to protect themselves. So thank you, and let me know if you have any questions. Yeah. Great input. Yeah, always get politically involved where you can make the change that you want to see. Yeah.
Some of the barrier in some of the other states due to parents or due to other protocols that don't want to allow certain things to be taught to their children?
So some of it does depend on the state law, because schools won't want to do things that are in direct violation of the state law most of the time. And then in the states where, for example, medically accurate information is not required, some schools do provide medically accurate information, but that would be left up to the individual district or sometimes the individual teacher who is teaching the subject, right? Because legally, if not prohibited by their individual school, they could say whatever they want. Did that answer your question? Okay. Yeah, most parents actually do want their students or their children to learn about safer sex and would not mind, according to survey data, I'm not just making this up, and it's something like 88% do want safer sex to be taught in schools, like sexual education, and then 78% are either okay with or would like for LGBT topics to be represented in their students' sex ed or public health or health classes. So it's not unpopular among parents and the general public, but we're still behind. Anyone else? Okay. Mm-hmm. All right, thank you.